At Henry Ford Health, we believe in helping you take small, powerful steps toward a healthier future. If you've been told you have prediabetes or are at risk of developing type 2 diabetes, you're not alone. And more importantly, you're not powerless.
Prediabetes means your blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. It's a serious health condition that affects millions of adults in the US. And most people don't even know that they have it. When your body starts having trouble using insulin properly, sugar builds up in the blood instead of being used for energy. That's prediabetes, and it can lead to type 2 diabetes, heart disease, and stroke if left untreated. But here's the good news. Prediabetes can be reversed, and that's where Henry Ford Health's Diabetes Prevention Program comes in.
The Diabetes Prevention Program, otherwise known as DPP, at Henry Ford Health, achieved premier recognition by the CDC for our Lifestyle Change Initiative. Our program uses proven strategies to significantly reduce the risk of developing type 2 diabetes, especially for adults over 60 who face a higher risk of progression from prediabetes.
Our goal is to meet you where you are. This program isn't about perfection, it's about progress. We're here to support your journey, step by step.
You'll learn how to set realistic goals, eat better without dieting, stay active in ways that fit your life, and cope with stress. These tools aren't just for 12 months, they're for life.
The program begins with 16 weekly sessions and then shifts into monthly check-ins. You'll stay connected to your coach and your group, both virtually and in person, whatever works for you.
Seeing people reclaim their energy, their health, it's what keeps us going.
I was really excited to get into the whole journey of learning how to take better care of myself. And throughout that journey, I made friends. We had a great no judgment zone, so you could come in and you could tell about how you ate too much of this or didn't exercise or things like that. And it was still a very supportive group. Like, hey, we're all in this together. Let's keep moving forward with this.
Activity level was never a big issue for me, so that wasn't what I was focusing on. I was focusing more on the eating habits and staying away from the sugars, and that alone made me feel amazing. Like my joints didn't hurt anymore. I could sleep better at night. I wasn't moody. I didn't feel upset. I didn't have an upset stomach. Those are just by making little tiny changes. And I think that was the biggest thing. I think everybody thinks you got to make this big giant change to become healthier, and you don't. It's just a little bit at a time.
I learned a lot about eating. I learned a lot about the importance of exercising, and the camaraderie that we had amongst our little class. It was only like 6 of us, but we really made an impact on each other's life. I would open up to them about things in my personal life, and they would do the same for me. So it made us feel more like a family of friends.
Take a moment and ask yourself, what's one reason I want to be healthier? Am I ready to try something new with support? You don't have to be perfect, just willing, and we'll meet you there.
We know what you're thinking. Do I have time for this? What if I've tried and failed before? Is this really for me? You don't have to figure it all out today. We take it one step at a time, together.
So this class has made some drastic changes in my thought process. I've made some permanent changes as far as my health is concerned, and it's made a difference. I was at one time concentrating on my weight. I have lost weight. My numbers have come down. I'm now at a 5.4. So I'm just grateful that my doctor is happy. So I'm just trying to keep that formula in my mind and to keep constantly staying on that path of being healthy and not to be a diabetic. I want pre-diabetic not even to be in my health as far as I'm concerned.
So it is really about taking better care of myself. I've been on high blood pressure meds for well over 10 years. Last year when I went in for my annual visit with my doctor, I had a talk with her about my blood pressure and being on high blood pressure medications. And I told her, this is something that I should be able to control. I really want to do something to come off of these meds. And she said, oh, there's a program that I can enroll you in if you're interested. Absolutely, sign me up. Let's see where it goes.
Diabetes is a silent killer, okay? People have it and don't even know it. And you don't want nothing like that if it can be prevented. I'm still pre-diabetic, but I'm not 6.1, I'm down to 5.7. And the doctor was like, well, keep doing what you're doing.
I would tell you that the biggest thing that I got out of the program is the friendships that you create in the program. Like, I'm from a whole separate county. I drive an hour here for these classes and an hour home. Like, and they're like, well, you can, you know, we have a program closer to your house. I'm like, but I've bonded with these women now. And it's like, they're great. We all keep in touch. We're all talking about taking a vacation together. I mean, that's all focused on this program. And it's just being there for each other and having that accountability together. And I think if you want to help yourself, the best way to help yourself is to help yourself by helping others and being with other people with the same goals, the same ideas.
We call ourselves family. We talk to each other, we encourage each other, we give each other recipes. When one of us is having a bad day, somebody will text somebody and say, okay, you can make it. It's a big difference. It's a comfortable place to be at. You can tell people, I believe you feel like you're comfortable enough where you can express yourself and let people know how you're feeling on that particular day. And you can get encouragement, and you can get tips what you need to do as far as maybe to push you away from this or encourage you to do that. So I'm very, very comfortable and I'm so glad that I got into this program. I'm really satisfied.
Listen, this program is about you making you number one in your life. We are so busy when we become parents and grandparents. We're already siblings and we're somebody's son or daughter. We're busy taking care of everyone else and we forget to take care of ourselves. This is about saying yes to you, not saying no to everyone else, but saying yes to you. Yes, I want to be a healthier me. Yes, I want to be around to be with family in different events and to enjoy my grandkids and to enjoy the fact that I worked really hard when I was younger and now I can relax and I can really enjoy life a little bit more. So joining this program is your first step to saying yes to you.
Listen, guys, I was the only male in my class, okay? So it's very important. You know how men are. We don't like to go to the doctor. Oh, they're going to tell me something I don't want to hear. Go and listen to it. Maybe you can do something about it.
If you meet these criteria and are ready to take the first step, we're here for you. Call 313-876-8300 or email hfhsdpp@hfhs.org to speak to an enrollment specialist. Want to find out more? Take our diabetes risk assessment online today or complete the form below to receive a free gift.
No matter where you are on the path, the journey starts with one decision.
A healthier you is possible.
And we're here to help every step of the way.
Every step of the way.